Well, ensuring that healthcare professionals are equipped to make the best use of artificial intelligence. To that end, a curriculum will be developed for their training and qualification. There will also be support for joint research and innovation projects. The deal was signed between SingHealth and AI Singapore at the opening of the AI Health Summit. The education programs will start in June. They will include a 10-part e-learning video, as well as physical classes and workshops. Topics include AI tech in healthcare, such as deep learning and AI ethics.
We're looking at how AI can help in the shorter term to enhance clinical decision support, increase the productivity of our healthcare teams, and support individuals, patients, but even better, healthy residents in their healthier SG journey around preventive population care. We have to work together with industry leaders, working on measures to ensure patient safety, and that we have the idea of well-being at the forefront of the use of our technology.
And to tell us more about how AI in healthcare will impact patients, we're joined now in the studio by Lawrence Liu. He's from AI Singapore, the national program to boost AI capabilities. And also with us this evening is Associate Professor Daniel Ting. He's from SingHealth's AI office. He's also the co-organizing chairperson of the AI Health Summit. Good evening, gentlemen. It's good to see both of you. Yes. Professor Ting, let me begin with you. Share with us where AI is actually having an impact in the healthcare setting.
Yeah, thanks. AI is considered as a fourth industrial revolution, and I would even say that we are at 4.5. For the last 10 years, AI have shown great promises in helping us to make better decisions. So, for example, now we can run AI algorithms on the breast, the mammogram, to actually help to screen for breast cancer, for example. For myself, I practice as a retina surgeon, and right now we are running the AI algorithms to help us to detect some of the bad diabetic eye changes among the diabetic population in Singapore. And of course, I mean, more and more, many people, including myself, we are currently, wearing more wearables like Fitbit, smartwatches, Oura Ring, to help us to really manage our, the calorie intakes and step counts. And, so, I mean, SMS, Dr. Janelle this morning was saying, the Singapore is pushing towards the healthier SG. How do we encourage people to live longer, but also healthier, and of course for myself to see longer and see better? I think this is some of the things that AI can play a big role, yeah.
So we are leveraging on AI in many aspects of healthcare. What challenges do you anticipate in this sector, though?
Yeah, so I think AI has great promises, but of course we actually really need to use it quite carefully. For example, like the safety, usually when we actually deal with the patients, this would be the key when we deliver care for any populations, whether it's going to be in Singapore or globally. So for AI specifically, we need to know how the AI was being built, because a lot of AI come with biases. So how does each of the AI algorithms deal with the biases, and whether this is a suitable or the right products for the right population is something that we actually are concerned about. The second thing that we always is key to our heart is the data protection. So without data, you cannot build any AI algorithms. And for the data to flow into the AI system, we need to make sure that these data is being protected wisely and also safely. So, I mean, those are the two key components that I think for anyone who wants to use AI algorithms in the healthcare settings, this is the top, the two components that is really, really key.
All right, given these concerns, let's bring that to you, Mr. Liu. Now, you are from AI Singapore. That's our national program to boost AI capabilities. So what Professor Ting was mentioning, all these concerns right now. So your curriculum, I take it, will need to meet those concerns. So give people the capabilities to do what he says, to take the care they need to take.
Yes, correct. So this curriculum will be jointly developed between SingHealth and AI Singapore. And, like what Dr. Ting has said, there's a lot of safety concerns and ethical concerns. So when we are designing this curriculum, we want to make sure that the doctors and nurses, the allied health professionals, are made aware of all these issues when using such AI systems.
Just very quickly, they may be made aware, but are they given the potential to address whatever they are made aware of based on your curriculum?
Yes, typically. So a well-designed AI system will allow the users to feed back to the developers or the administrator that, hey, this system is not working so well, or it's time to retrain the AI model. So this, again, are knowledge that we want to make sure that the users are made aware of.
Right. So, I mean, looking at it from the patient's perspective, though, what's it going to mean by way of costs to them?
Yeah, so I think the questions, this is a very common questions. How much to put in? How much should we, invest upfront so that we can actually encourage the residents or the patients to live longer? So I think the upfront cost is unavoidable, right? So that's number one thing that we all know. But by preventing patients from going into hospital, by preventing the patients from going in, getting admitted to the ICUs, for preventing or even preventing patients from developing any disease-related complications, I think the long-term cost, hopefully we can actually justify, say in 5, 10 years' time or even 15 years' time. Yeah.
So, Dr. Ting, this is looking long-term.
Yeah.
So when you say patients will be spared certain costly and potentially very difficult procedures, well, because of what AI can do. What else? It's a rather obvious question, but if you could look shorter term, how would a patient benefit from the kind of AI infrastructure that individuals like Ms. Liu are trying to put in place with his curriculum?
Yeah, so I think something called a ChatGPT, not sure, how many of you are aware, the founders had a pretty chaotic week, we know, for the last 2 weeks. But having said that, this is the single most powerful AI engines that we have seen in the mankind history for the last 100 years. So if you look at how we could potentially apply a technology like ChatGPTs or other large language models or engines, I think that could actually, ease the patient's communications. And a lot of the patients sometimes may just needed to ask questions. So right now we are currently developing some AI chatbots powered by large language models to help the patients to, get their the questions answered pretty quickly. Yeah. So I think this is one of the transformative, AI algorithms that we potentially see we can actually use in healthcare. Yeah.
And Mr. Liu, you're confident that you'll be able to get the right kind of training for the professionals who will be involved in this as well. Tell us something about that process.
Oh, definitely. I mean, in AI Singapore, we have developed training curriculum the last couple of years, including certification, AI apprenticeship programs. So we are very familiar. So one of the reasons why we have this collaboration is really to bring our expertise on how to create this sort of rubrics and metrics to make sure that the AI professionals are properly trained within the regulations of the healthcare sector.
All right. Gentlemen, thank you very much for coming into the studios.
This is Lawrence Liu, Director for AI Innovation at AI Singapore, and Associate Professor Daniel Ting, Director of the AI Office at SingHealth, and of course, co-organizing chairperson of the AI Health Summit. Thanks for coming this evening.
Thank you.
Thank you.